Hi, it's Dr. Riley, and I have another talk today. Today, it's going to be about the treatment for patients when they present with anxiety. So, this is like the second part of another lecture, and this is actually after we've already made the diagnosis and we already know that the person has anxiety. So, now what do we do with them, right? And just to recap, usually the most important things when we're making the diagnosis is we need to know the history. Is there anything going on? Like, are they already being treated with medicines, or are they taking any medicines that cause anxiety? Is their sleep appropriate? Are they exercising? And certainly their diet, right? So, normally, when I see a patient, the first thing I usually talk to them about, if they seem like they have anxiety, is their diet. And one of the things that we see is that there is something about eating healthy food that seems to help you with just about any kind of medical problem that you have. So, normally, when we have someone who has anxiety, if we can get them to eat healthier, then usually we'll have a good outcome. And, this is not something new. So, apparently, this has been known since the ancient Egyptians that if you eat unhealthy, then you're going to have problems. And we know that there are certain foods that cause people to have anxiety. So I don't think it's a surprise to someone if they found out that their kid was having Starbucks, multiple times in the day, if their kid started to present with anxiety. And just like caffeine, there are other additives in foods and colorings and things like that, that as we go through the diet, we can sometimes actually figure it out. But surprisingly, there are some foods that actually seem like they're cures for anxiety that actually get rid of anxiety. And as you might imagine, fruits and vegetables are on this list, but really, it's things like fish and seafood. They really seem like they do a good job for this kind of stuff. And I definitely do see a lot of my patients when I bring this up, they make they make like a yuck face because they're not big fans of fish, right? But it is something that fish is actually very helpful, and then meat really of any kind. A lot of times when we do our evaluations and we find out that the kids have anxiety, what we find is that they're low in everything that you find in chicken and fish and meat and things like that. But especially fish is the best source for omega-3 fatty acids that we'll see later in the talk. Some people are taking pills to replace the omega-3 fatty acids, but the best source of omega-3 fatty acids is fish, because there's definitely other things that we find in fish that seem like they have very salutary effects for your health. Now, your mom told you to eat fruits and vegetables, and she was right, because eating a variety of fruits and vegetables is actually very helpful for anxiety. And making sure that you're not eating foods that make anxiety worse, ones that are high in sugar, processed carbohydrates, and low in nutrients, all those things are very good when you have a problem like this. So, in general, what I tell people is that when you have anxiety, like when you have any other medical problem, you have to eat healthier than everybody else if you want to get better faster. So that's usually good advice for almost any medical problem that you have. But anxiety, especially since it is like one of these things that cause a lot of suffering, we want to make sure that the kids are eating healthy, right? So usually what I try to do is I try to get them to eat things like eggs for breakfast, and not waffles, pancakes, French toast, bagels, all these kinds of things. All Everything that's very carby seems to release adrenaline in your body. And a lot of times when you have anxiety, part of your problem is like too much adrenaline, right? So why do that? Why eat things that are going to raise your adrenaline? Why have something that has chocolate in it if it has caffeine? Just avoid those things, and maybe you can avoid being put on a medicine. Now, exercise is another thing that we talk about, and if I see a kid is exercising all right, certainly, or already, or like a lot, I don't necessarily torture them and tell them they have to exercise more. But that's usually not the case. Usually, the kids who have anxiety are usually kids that they're fairly sedentary, and we were not designed to be sedentary, right? So to try to see if we can kind of do some exercise, all those kinds of things are actually very helpful. So it doesn't matter to me what kind of exercise they do, as long as they do something. but there are definitely studies where it seems like doing aerobic kind of exercise is helpful. But yeah, in my experience, doing anything is actually much better than what they're doing, which a lot of times is just laying in bed and chit-chatting on their phone. Now, this is one of the hardest things, but also the most impactful is sleep. And we know that kids are not getting enough sleep. And what is the side effects of not getting enough sleep? Well, then your body has to try to keep you awake. And what does your body do to try to keep you awake? Well, it releases hormones that help to keep you awake. And these hormones cause anxiety. So, probably the number one reason why I send people to someone to talk to regarding their anxiety is because the kids are not sleeping enough. And they do need a lot more sleep than people really realize, right? And the problem is for every individual kid, they think that they're the ones who need less sleep than everybody else, when in reality, if they're coming to see me because they have anxiety, they probably need more sleep than everyone else. So they have to be one of the best sleepers. And this is one of the real takeaways, that if you're going to be an anxiety kind of person, yeah, instead of taking or doing a treatment, then maybe what we should do is we should become healthier, because maybe the anxiety is a side effect of not being healthy. So what we want people to do is sleep better than everyone else, exercise better than everyone else, and eat better than everyone else. And a lot of times these things are going to go away. Now, while we're waiting for all these kind of good lifestyle measures to kick in, because they unfortunately don't work overnight. It's not like you can go out, exercise, sleep for 9 hours, and have a salad for dinner, and then the next day you're going to feel great, right? It is a thing that your body is not so easily tricked. So it is the kind of thing that there are other things that we can do that are actually helpful. And I list some of them here, and we're going to go over them in a few minutes. But these are adjuncts, right? These are not things that are like the cure. If you're not leading your life in a way that's like anxiety friendly, and your plan is to try to overwhelm a poor lifestyle with treatments, then you are going to be sadly mistaken, because even with medicines, this is not usually how it works for most people. Now, I think that probably the thing that most people are most accepting of is maybe taking some vitamins, right? Because certainly if you're not eating a good diet, you usually are going to be low in vitamins. And there are definitely some studies that were done that where they gave people who were suffering from anxiety vitamins, and they seemed like they did well. And one of the most famous ones was using this kind of vitamin after there were some earthquakes in New Zealand, and they saw, yeah, a huge decrease in the amount of anxiety in those people. And it's the kind of thing that, when you're giving someone vitamins and you're giving it to, let's say, everyone around the time of a natural disaster, and it seems like it helps prevent anxiety, there's something going on. And so this is again a recurring theme, that the healthier you are, the more likely you are to resist anxiety, because we can't stop things happening in our life that are going to cause anxiety. But if we're healthier, then we'll be more resilient. And resilient is a word that you'll hear a lot regarding anxiety, where we're able to kind of suffer the slings and arrows that life throws at us without actually having it cause us a lot of problems. But it's not just that vitamin. It seems like it's a lot, anything that's has a lot of these B complex vitamins seem helpful. So you see here, I also have another vitamin that actually they've done studies, and it seems like it works very good to prevent anxiety. And here also as well, a lot of studies, or I post excuse me, a single study, but you could see a few different kind of studies. All of them are basically having B vitamins. So usually it's the kind of thing that it seems like, yeah, if you're having anxiety, if you kind of bump up your B vitamins, ideally through diet, but certainly they do sell various forms of these B vitamins in the store, and then they're very helpful. Now, as we talked before, there's something about fish. Ideally, you will eat fish, and usually I try to get people to eat fish 3 times a day. But there is some. Oh, excuse me. Did I say 3 times a day? 3 times a week. If you eat it 3 times a day, it works much better. But I don't know if anybody can eat fish 3 times a day. but and actually, I don't know if that's going to be so good for us, right? Probably 3 times a week is probably the best way. But what I usually find is the person saying, "Can I take fish oil?" And the problem with any of these fish oils is that they can spoil, right? And especially the ones that are over the counter, you don't know how long they've been there. And because they're in an oil form, they can become oxidized. And when you oxidize an oil, we're not sure how great that is. So that's why one of the reasons why we think that a lot of these kind of studies where they give people fish oil, um, some of them don't show any effect. Now, it does seem like it has to do with how much. So if you can have a certain amount, over 2000 in a day, so like 1,000 in the morning, 1,000 in the afternoon or in the evening, that seems to work a little bit better. But yeah, it seems more reliable that if you eat more fish, then the better you are. And certainly, one of the reasons why I think eating some of this omega-3 oils as a pill don't work is because if you're eating a lot of inflammatory seed oils, so these are the regular kind of oils that people might cook with, like corn oil and canola oil and safflower oil and things like that. They have a lot of other kinds of things in it that are actually not good for us, right? So we want to kind of try to stay away from these kinds of things as much as possible, right? And the problem is that when you go to a restaurant, they're only cooking in these vegetable oils, and I'm not sure if I'm in love with this kind of stuff, right? So it is the kind of thing that the more you can eat at home with, even if you're using an oil, if it's fresh and you're using a new oil every day, it's much less likely to have some oxidized components in it. But yeah, the more we could stay away from these inflammatory seed oils, the better. And the more we can eat fish, I think it's healthier. Now, magnesium, and again, another B vitamin. So this is one of those things that one of the things that we see is that when your body is under stress, we see more magnesium ending up in your urine. And so they've done studies like this when kids are taking hard tests, and they actually see that they're able to, or their body actually gets rid of their magnesium. And if they start out with low magnesium, this seems to make anxiety worse. And getting rid of your magnesium when your anxiety is worse, that's not so good for you in the long run. Magnesium is also absorbed in our diet um, through the action of vitamin D. And one of the things I'll see is a lot of my guys, as we do our blood tests, we usually check for vitamin D, and we'll see that they're low in vitamin D. So that makes it harder for them to have enough magnesium in their body. They're usually eating diets low in magnesium, and part of that is just the fault of how we do our agriculture. But part of it is that they're usually not eating the foods that are the highest in magnesium, um, which is some of the ones that you see in this picture, but especially like things with leaves tend to be fairly high in magnesium. So yeah, so then you're a setup that when something happens to you, you're more likely to have anxiety. So what we usually do is try to encourage them to eat foods that have more magnesium in it. And sometimes we'll give them supplements, but I have a caution here on the side that not all magnesium supplements are the same. And some of them are made for people when they're constipated. And if you take something like that, one of the ones that are made for people that are constipated, then it's not going to go inside your blood, and you're going to just be having diarrhea, and you're going to be wondering, why did I recommend for you to take magnesium? So yes, try to eat healthy and you'll get your magnesium more. Now, inositol is something that probably most of the people haven't heard of, but it's actually also a B type vitamin, and it is actually something that has been studied, and it does seem like it's very helpful for anxiety. Now, we also give it for kids when they're having PCOS type symptoms, and it seems salutary in this effect that if you have 4 grams in a day, that it really calms down some of the effect that we see in the PCOS. I believe it does this by raising something called the sex hormone binding globulin. But normally, yeah, if you're eating a regular kind of diet, usually you're getting about 1 gram of inositol in a day, where if you're eating enough fruits and vegetables. So what we do when the kids are suffering like this, or especially a kid who has anxiety and seems like they're having signs and symptoms related to the PCOS, such as having hormone abnormalities, which again we would have done as part of our blood workup from the first lecture. Then usually this would be a no-brainer, and we would give them the inositol, which usually comes as a powder, and we would try to get them to mix it together with in water, or like with, if they're having anxiety, like we'll see in another picture or another slide, something like chamomile tea, which is also very relaxing. Vitamin C, yeah. So they have done a small study where they gave kids who are getting ready for tests, and they gave them vitamin C, and it seemed like vitamin C helped them, right? So certainly eating healthy seems like, again, has a lot of good benefits, and we're learning more and more all the time that, yeah, when you're low in some of these kind of foods, then or some of these nutrients, you're going to get yourself in trouble. And it is a thing that some kids, when they go to college, my kids have told me that the kids talk about getting the scurv, which is scurvy. And scurvy comes when you don't eat enough vitamin C. And you can imagine some of these guys, when they go to college, they're not eating, anything that's on this slide. And so they get themselves into trouble. Chamomile tea is actually very well known to be relaxing, and especially if a kid is getting into a habit of drinking things with caffeine, switching them over to some herbal teas that are very well known to have relaxing qualities, that actually is kind of a win-win, because you're getting rid of something that actually makes them anxious and replacing with something that's very relaxing, right? And chamomile tea is considered to be super safe, as is lemon balm tea. Lemon balm tea is particularly good for the kids who are having problems sleeping. So actually, chamomile tea, you'll find it in the same part of the supermarket where they sell teas, and a lot of times it's mixed with peppermint, and they'll call it sleepy time tea. Lemon balm is a little bit harder to find, but it actually seems like it has more effect in terms of allowing people to go to sleep. So especially if you're having problems sleeping and you're anxious, taking some lemon balm tea before you go to bed, that seems like it would be something that would actually be very helpful. And then, this is a little bit harder, but there are definitely studies where people who are just seem like they have this anxiety kind of phenotype, a couple of amino acids that they do sell, lysine and arginine, they actually seem like they're relaxing. I don't really use it too much. I usually try to get the person to eat more meats and things like that, and usually that should be a good source of both of these amino acids. And then there are the last two things that are not SSRIs, because really in this kind of talk I wanted to talk about things that are not really like real medicines that people give, like like them, Prozac and things like that, which apparently 1 out of every 5 kids are on these kind of medicines. And it just seems to me, when you have as much gray hair as I have, how did this happen? Where all of a sudden guys are taking all these kind of medicines? And back in the day, what we would have done is, if we did all these kinds of things, we would start them on something like hydroxyzine, which hydroxyzine would be something that you could use as you needed it. But it's well known to actually, I tell people, take the edge off, right? If they're starting to have problems with anxiety and they just want something that they could take every once in a while, people who are not big fans, they say, yeah, this works because it makes them tired, but actually, not really. It is a thing that, although it is in like a family of medicines called antihistamines, so it is kind of like a Benadryl, which Benadryl will make you tired. But if you take Benadryl for anxiety, it doesn't seem like it does anything. But hydroxyzine is actually listed as a medicine that seems like it does help for people when they have anxiety. And it's one of these kind of medicines that we dose to effect. It comes as liquid, so we could actually give it to even people who don't take pills. And yeah, it works pretty decently for people. And so as does the propranolol. Propranolol, probably people use it more for when they're having, stage fright or other kinds of things. So propranolol is a beta blocker. So we talked about before how anxiety a lot of times can be from the release of adrenaline inside your body. So you could think of it as something that, as your adrenaline goes up, if there was something that we could do that we could lower your adrenaline, then that would be actually helpful. I would say that usually when I give it to people, yeah, they would not be a big fan of using it every day, because we need adrenaline to do different kinds of things, and certainly if you have a history of asthma, we're not going to want to give you propranolol. But it's very good, like if you're having just intermittent episodes where you're having a lot of anxiety, and you don't really need to be on something like every single day, but again, you need something that you can take the edge off, so that way you can help yourself by going to a counselor to talk about anxiety and how not to think about anxious thoughts. But if you need like a little bit of a boost to kind of like get over the hump of some kind of anxiety provoking event, then this is actually something that you can use to good effect, and you could just use it every once in a while. And both of these kind of medicines are things that you don't use every day. You just use it when you need it, right? And if you're having more symptoms, then you can use it. Um, you can use it. They're safe, but usually we're not going to be wanting to give it to people every single day. So then that's it. I hope you've learned something today about anxiety, and certainly it's the kind of thing that there are a lot of other things that we haven't talked about today, and I would say that these kind of talks are for informational purposes only, and usually this does not take the place of dealing with a personal physician who would know you, right? So that's what I would say, that if you're having anxiety, then to go to see one of the doctors, right? Doctors, this is all we do for a living, and it is a kind of thing that I think that you can get actually a lot of help by reaching out to your pediatrician and seeing what would be the best course of treatment for you. All right. Thank you.